Hi, everybody. Today, we're going to practice a little more work with learning how to deal with your symptoms in a somatic way. And what I'd like all of you to do is to get comfortable here. This is going to be a way that you learn to attune to yourself when you're having chronic somatic symptoms. And this practice can be done anywhere, any place, anytime, and it can be done for any length of time as well, for a few seconds to a few minutes to a longer length of time, like 15, 20 minutes or even longer. And what we're doing is we're getting into a state of attunement, a state of perception that I want you to have in relation to your symptoms, in relation to what you feel in your body. And what we're trying to do here is learn how to process or reprocess your symptoms in a more healthy way, in a way at the brain level that can shift what you're feeling. So get comfortable. You can keep your eyes open or close your eyes if you'd like. And I'd like you to just let yourself relax first here for a moment. I want you to let your mind relax, let your body relax, and just know at this point in time, you're going to shift your attention to yourself. And in a way that you're going to notice what you're feeling in your body. We're going to tune to the sensations or the feelings you have in this moment. And whatever you notice, we're going to do this in a way where we attune to your symptoms or your sensations in a certain way. I'm going to walk you through right now that you can come back to and practice each day or at different times. So the first thing we want to do when we attune to what we're feeling in the body, especially with these chronic somatic symptoms or the somatic symptoms you're experiencing that have not had an organic cause, not structural in nature, is they're more related to your nervous system and brain. So that's how we're working at this level to shift your perception, number one, in your brain of what you're dealing with. What you're feeling right now, if you're noticing any symptoms in your body, I want you to perceive these symptoms as being okay. This is very important that you right now can tune into what you're feeling and have a perception that this experience right now is okay. Even if it's very unpleasant, it's very painful, it's very intense. It's can be quite difficult to stay in this mindset when we're suffering or feeling very strong sensations or symptoms. But I'm going to ask you right now to put a filter or a lens in your brain, a perception that you're turning on right now, that you're going to perceive what you're experiencing right now. If you're having symptoms, that they are all right, they're fine, they're okay. We need to put a positive lens in there because for two reasons. One is they are okay. They're just produced by a stressed brain and nervous system. So there isn't anything wrong in you. And two, we need to see them positively so we can shift the brain and the brain's perception, because it is the brain and nervous system that are the cause. And it's because of negativity, negative emotions, negative thinking, negative reactions, negative patterns in your brain that have been set up and that are kicking out right now the symptoms you feel in your body. So let's allow ourselves right now to get positive, to perceive what you're feeling right now and in the rest of this session and any other time you attune to your symptoms. I want you and need you to do this in a positive, perceptive way. Okay, your perception is that these are okay. These are fine, what you're feeling right now. It's okay. It's unpleasant. It's uncomfortable. It may be very strong, but for you to shift your brain around this, you need to see this as not being dangerous, evil, bad, harmful, hurtful to you, that these things are something you need to do something about, because many of you have tried doing things about this and it hasn't worked. And the more negative you get in your perception in your mind, the more you amplify and create more symptoms. the more you stay in the symptom loop. So just perceive very lightly, very gently, whatever you experience right now. I want you to perceive that as being fine. It is fine. It's okay. You're also fine and okay. You're safe. You're secure. You're able to tap into what you're feeling now in this way. This is called affect tolerance. It's a term. It's the ability to tolerate the affect, which is the feeling you have right now in your body, and to open to this feeling. So the window of tolerance is what it's also called. Window of tolerance right now, where you're opening up to what you're feeling, opening your window to experience this feeling. And I want you just to relax. The second thing I want you to do now is to just relax into what you're feeling. Relax your mind and body around these feelings. Exhale if you need to, because again, what you're experiencing is okay. We need the nervous system to calm down now. We don't want your nervous system ramping up, going into more fight, flight, or even shutting down and going into freeze. What we're doing right now is we're relaxing because what you're experiencing is actually okay. It's just being kicked out by a scared or frightened or insecure or emotionally reactive or sensitized brain. You're okay. And what you're experiencing is also okay right now. So relax. Let go, surrender. Just relax more deeply right now in your mind, in your body. There's nothing you need to be doing right now about what you're feeling. There's nothing you need to be trying to solve or fix or change or modify. I want all of you just to relax more now. Exhale. Relax. Relax even more deeply right now because you are completely fine. What you're experiencing is just an output from your brain and nervous system in your body that's unpleasant, uncomfortable. We don't need to do anything about this except allow it to keep unfolding and for you to start perceiving and continuing to perceive it as being all right. That helps to shift it. And it's also the truth here when we're dealing with these type of conditions. So continue to relax and continue to perceive whatever you're experiencing in your body, your symptoms as being okay. So then because they're okay and because we're relaxing, we're going to open that window now, that window of tolerance to what you're feeling. We're going to invite in now, I'm going to ask you to invite in, to welcome in whatever you're feeling. Invite it in, welcome it in. At whatever level it is, at whatever feeling it is, continue to invite it in, welcome it in. You can talk to your symptoms in this way. You're allowed to stay here for as long as you'd like. Be my guest. Come on in now and have your say. Whatever you want to do, it's okay. Absolutely fine. Relax. And in this way now, as we invite this in, we welcome this in. And it's very paradoxical what I'm asking you to do here, because most of the time we don't want to feel this. We want to push it away, stuff it down, fix it, make it go away. And I'm asking you now to do the opposite in so many ways, asking you to see these symptoms as being fine. I'm asking you to relax when you don't want to relax. And I'm asking you to invite in and welcome in the very symptoms that you don't like, to do the opposite. And in doing the opposite here of inviting in what you're feeling now and opening to and relaxing into and perceiving this as being okay, what you're doing is shifting your brain right now and its perception of this whole thing. You're flipping this on its head. You're no longer fighting it, fleeing it, freezing it. You're facing it. By inviting it in right now, you're facing what you're feeling. And you're facing what you're feeling in a very positive way, that it's okay. And you're relaxing your brain and nervous system right now, which helps to calm it down and to show your brain that you're okay, that you don't need to get worked up or shut down over this. This is just sensations in your body coming from your brain. It's okay, everybody. Let's relax more deeply now. Let's open more to the experience of what you're having now. Let's see it as being absolutely fine, absolutely okay. We can just more go into a relaxed state. We can accept and allow what you're experiencing right now because it is fine, because you are okay. So open to it, allow it, invite it in, welcome it in. And it's allowed to stay for as long as it wants. We're not going to try to push it away or make it go away in a certain amount of time. And in this way, we drop the timeline right now of your healing, which is so important. We don't put a pressure on yourself to fix this in a certain amount of time, because that just adds more stress right now to the process, which could add more symptoms. Reducing pressure, reducing stress, reducing expectation that this needs to go away right now or soon, because it's fine. There's no need for it to go away right now. Of course, we'd like it to, and it will at some point, but it will more when we can practice this in this way. It's very different from what you would normally do because we're working with your brain and nervous system. So far, I'm asking you to perceive this experience now that might be unpleasant in your body, uncomfortable, possibly severe. I'm asking you to be okay with this at a high level, at 100% level. Because neurologically, it is okay. There's no damage in your body. There's nothing wrong with you, just your brain and nervous system acting up. And two, I want you to be okay with it because that helps it to become okay. Shifting your brain into a more positive perception instead of going to the negative reactions and negative perception that we do, which just makes it worse. Two, I'm asking you to relax more right now. Keep relaxing into what you're experiencing because it helps to calm your nervous system down, helps to get settled into that nice parasympathetic state, which has been called the healing state, the rest and digest state. And as you're falling into this resting state more deeply now, your nervous system can start to digest what you're feeling, can start to digest the chemicals that make up your sensations. So relax, continue to relax into whatever you feel. Continue to perceive what you're feeling as being okay. You're okay, it's okay. And intermittently continue to invite in, welcome it in, ask it to come in. Don't shut down to it because that shutting down is a form of resistance. And what we know is what you resist persists. What you resist persists. And what you embrace, you shall erase. What you embrace, you shall erase. So let's embrace this with an openness, which is relaxed openness of positivity, that it's fine. That we don't need to do anything right now to fix anything, to stop anything, to change anything. Our nervous system, our brain, right now, as we're getting it into the right state, it's going to do the job for us. So we can relax even more because there's nothing for us to do. Just like you don't digest your food, your system does it for you. And then the more you put your nervous system and brain into a resting, relaxed state, the more easily it will do its job of digesting this stuff. The more you stop fighting, the more you stop fixing, and the more you start relaxing and seeing this as being okay, the more your brain shifts, the more your nervous system shifts into this nice state of breaking this down. And the more you invite it in, the more you welcome this in, and the less you push it away and the less you run away from it, the more it has a chance to come in and leave. It needs to pass through you to go. It will go on its own. So let's stop pushing this away and doing the opposite of what many of us do by inviting this in, welcome it in. It can stay as long as it likes. We're going to relax into it. And we're going to perceive it as being absolutely fine so that it becomes fine. Our perception of it, our belief of it helps it to become okay, helps it to soften, helps the symptoms to reduce. So let's go about this, everybody, in this way, the way I'm teaching you today. If you have questions about this process or want to learn more, just join my sessions. Come into the group sessions or one-to-one, working with many of you already. This is also a daily recording that I send out to my current clients and patients and people on the group. I send daily recordings each day. It's things like this, some practices, reminders, things that we want to focus on for our mind-body healing. So if you're interested in that, you can go to the website. Again, if you haven't already signed up at thepainpt.com, and you can find more information there. And if you like this video on YouTube, give it a thumbs up, spread the word. This is a somatic approach I'm teaching you right now that combines the way you perceive and process these symptoms. It's very different from what we would typically do. And again, we're working on the chronic symptoms within this way. We're working on somatic symptoms that have a brain and nervous system origin to them. They're not your typical ankle sprains or structural symptoms in your body. Those things are treated differently, and those things will also go away in time as well. Just like a fracture will go away, a broken bone will go away, a sprain will go away. This is no different, except we have to work at the brain level now because that's where the issue lies. So we're doing some other things that other people don't typically do because these things would naturally go away when they're acute. But when they're chronic, they become stuck. They become lodged in the brain and nervous system now. And we have to use other strategies to allow this stuff to break down. Thank you so much, everybody. Again, I really appreciate you. And we'll talk to you guys next time. Bye-bye now.